Have you experienced adverse reactions to medication or treatment failures to your prescription medications? Have you taken or are you currently on medication that has not delivered adequate relief? Since most medical conditions can be treated with a variety of medications and dosages, it's time that you talk to your physician about pharmacogenetic testing. Asperio is a high-complexity national clinical laboratory that can potentially help your physician create a personalized medication treatment based on your genetic makeup. Asperio Laboratories utilize a saliva sample to provide your physician with an extensive, personalized report. Pharmacogenetic testing serves as a tool to help your provider better understand appropriate drug choices and safe medication management protocols, minimize side effects, reduce the risk of drug-to-drug interactions, and help reduce medical costs. Most insurances and Medicare cover pharmacogenetic testing for qualified patients. Ask your physician about utilizing pharmacogenetic testing to receive your personalized report. Asperio, uncovering the unknown.
Dr. Glick is here today to kind of talk to us a little bit about pharmacogenetics and what it is, why we need to be doing it, why your doctor should be looking at it. And so I'm just going to throw it out there to Dr. Glick. Welcome, first of all.
Thank you.
And what is pharmacogenetics? What is, and we call it PGX. A lot of people hear that out in the marketplace. What exactly is that?
Pharmacogenetics is testing patients' genetic types to find out how they metabolize certain drugs.
Is this something that is new, has been around for a while, or is something that you practice constantly?
I've heard about it for years, but in a more practical way, it's only been around in the last year or two. It's a very powerful tool to use with your patients to try to help understand how they're using their medications, whether or not they are getting side effects or not, or whether the medications are being dosed optimally.
Okay, so you have someone come into your office that may not be really responding well to a certain medication
all the time.
And so walking me through that, I mean, what do you hear from your patients a lot of times that that makes you say, aha, that's something that I should check out further?
Well, so whenever the therapy isn't being maximally resulted, the patient's not getting the results they're looking for, the symptoms are still there, we're still addressing it. This happens all the time. So doing this kind of testing can really get to the bottom of where the problem is and how we can adjust the medications.
Okay. Is it a pretty easy test, or
very simple test,
kind of walk us through a little bit of
so
how that works?
The patients come in and they get a mouth swab. There's 2 swabs that we swab the inside of their cheek, and from that, those samples are sent back, and 3 to 5 business days later, they get the results. So about a week later, we go over the results, and then from there, we can kind of adjust the medications. I find that, previously in medicine, we would just guess at what medications we should be using. And I mean, when I think back to my training, I go, well, I mean, what else did I have?
Right.
So I treat 100 people with drug X, and 25 of them have some problem. I just either assume they were the problem or don't like medicines or something like that. And I knew that there was some sort of liver enzyme problem with it, but I didn't know the details or what to do about it. And so this has really elucidated the vast majority of the problems. And so now when I'm dealing with not just mainstream things, which this helps with as well, but really complicated problems for people on multiple medications, you're able to really get in there and dial in like a laser and say, this is probably the guy that's the problem. Let's switch over to this class and see if that reduces our heart rate problem or our urinary issue or whatever it is.
Asperio Laboratories is a state-of-the-art diagnostic laboratory providing comprehensive pharmacogenetic and toxicology testing. The foundation of trust between patients and physicians is often clouded by the uncertainty of newly prescribed medication and the potential for interactions. When coupled with medication prescribed from specialists, the cycle can become even more complex. Medication adherence, multiple medication interactions, and potential abuse all lead to more questions and greater exposure for physicians, and potentially adverse medication side effects for patients. It all starts with our DNA, Deoxyribonucleic acid is a very long series of molecules consisting of a sequence of 4 bases, G, A, T, and C. Each human genome has 3 billion of these bases, divided among 23 chromosomes. The chromosomes are divided into genes, which are unevenly spaced along the length of the chromosomes. These sequences, along with other factors, determine how efficiently a particular enzyme functions. The resulting effect can be to increase its activity, decrease its activity, or render it non-functional. By studying these effects, researchers often find important clinical correlations. This is referred to as pharmacogenetics, the study of how genes affect a person's response to drugs. This relatively new field combines pharmacology and genomics to develop effective, safe medication dosages specific to an individual's DNA makeup. For even the most seasoned prescriber, choosing effective treatment options, medication, and dosage often requires time-consuming and potentially harmful trial and error. Unfortunately, this variability in prescribing and outcomes are regulated by factors that are completely hidden from the physician and the patient, and is only found in the patient's genetic profile. Fortunately, we now have Asperio pharmacogenetic testing, which provides doctors and patients with a detailed genetic report based on your genetic information that will allow for personalized medication choices that will more precisely target the symptoms and thus improve outcomes. This is how it works. Your clinic orders the genetic test. A saliva sample is collected and sent to Asperio laboratories. A comprehensive gene variation test is performed and results are prepared for your physician within 3 business days. Your physician utilizes a secure online portal to view the report that identifies genetic variations that may affect the way you metabolize certain medications. The test results, along with your physician's medical expertise, are used to make treatment decisions. Ask your doctor about utilizing genetic testing to optimize medication and dose selection for you.
So very powerful from a standpoint of being able to give the patient exactly what they need versus having this kind of shotgun effect, prescribe and cross your fingers type of a situation.
I was trained in this way, and this is not a knock to any physicians that are out there. This is the way we were trained to practice, but technology has advanced to a point where we can actually now start to do the things in a very tailored, individualized, personalized way for each individual patient. I mean, it's an easier way to practice.
You see this as something as becoming really almost like doing blood tests.
It's a necessity. It doesn't make any sense not to just do it on all of my patients.
90% of your patients get this test.
The only reason I don't have it on somebody is because they travel a lot and we've missed them or something like that. But yeah, no, everybody will have it done in the practice.
I was prescribed 2 different medications that just weren't working for bladder spasms and pain control. And come to find out, the medications that I was prescribed, I'm a rapid metabolizer on, which means that I was not able to process the medications correctly. So as soon as we got the medications that I was able to take, my pain is under control now. And now that I'm on the correct medications, I no longer have to take as much medication as I was taking before and or not having to take it as often.
My doctor was trying to figure out how we could resolve my situation with migraines and that I become very nauseous. The doctor suggested that I get this test that would test and determine what medications would work best with me. And then when I got the results of the test, and he did, it was very clear that the medications that I had been receiving over the years weren't the proper ones. They weren't really working with my body system.
My doctor ordered the test when I wasn't responding as expected to the medication that was originally prescribed. The sample collection was very easy. My physician just took a swab to the inner part of my cheeks and around my gum and submitted the sample to the lab.
Collection process is very simple and very easy. It's a quick swab of the patient's mouth. The samples are sent away, 3 to 5 business days, the results come back to the office, and then we can sit down with the patient and really go over the details of how they're metabolizing their drugs. The detailed report shows me how to adjust their medications, allows the patient to understand what choices we need to make and what categories of drugs we may need to switch to get a better result for that patient. It's laid out in a way where the medications are classified in groups, and then there's categories as to which medications we should avoid or stop using altogether, and helps the doctor decide to increase or decrease the dosages of those medications to get better outcomes in the long haul.
How many people would you say you actually, after you get the test back, have to make an adjustment to their medications?
60%, easy. Yeah.
So there's that 40% that you look at it and you go, this...
Right, for now though, this is based off of their current medications, their current problems, and we say, well, we're doing fine, or it doesn't apply. But that doesn't mean that they're not going to be in a car accident and need narcotics for a month or two, and then now we've got a problem. Or that doesn't mean that they're not going to develop AFib or get a DVT, and now we're going to have to develop another issue. So, the value for my patients not only is obviously picking the right meds, making the right adjustments, reducing the number of meds if necessary, but is having this information going forward for other events that they might occur.
What I'm hearing
lifelong.
Right, so you only have to do one test. Once you get the results, then medications may change as they get older, or as you mentioned, an accident, something like that. You don't have to worry about changing that.
Yeah, and I just tell my patients, give me a call. If any of these things happen, we'll get this information to your doctor in the emergency room in the hospital. And of course, the report's easy to read, so they just take a look at it, look at the categories. Because again, we can't expect all the physicians to be able to read the stuff, even though the report is very easy to read. At the time that you're dealing with some of these issues, like in an emergency room, those doctors are not up to this speed, but they're moving way faster than I would move in a practice. So understanding that and knowing that the report has to be simple, they've got to make a change, and it can make a huge difference. It's some powerful stuff. So we just get that information to them, the patient or the doctor, and I always make myself available to get on the phone for the doctor to answer any questions.
After receiving my results from my physician, I was so impressed with how it was delivered and the information that was given to me. I actually had my entire family come in and be swabbed, from my mom to my sisters. My grandmother's been swabbed. I've got a cousin that was having issues. And because the test was so beneficial, there's been a couple of my family members who have actually had medication changes where their health is now being managed and cared for in a much better fashion than it was previously. So I would recommend it for everyone.
It's very quick turnaround time. He called me in, as a matter of fact, gave me the results this morning. So I was really very happy to hear, and quite surprised, even to see the information about a lot of issues. If you have this situation, this is the kind of medication you should take. It's really fascinating.
I was really excited to review the results with my physician. The report was really easy to read, and he helped me to explain why the medication wasn't working at the current dosage. It was so exciting and enlightening to me that I was being treated specific to my needs and my specific genetic makeup on an individual basis.
I would recommend this test to anyone because it provides beneficial information.
Doing a pharmacogenetic test, I assumed that it would be very expensive, but I was glad to find out that it was covered by insurance. I would absolutely recommend this testing be done by everyone. It was a great benefit to me and my treatment, and the testing results are that I can take with me for the rest of my life.
What other areas do you see in medicine that it really does apply? I mean, you talked to your clinic and some of the things there, but what are some other areas in medicine you see that are very, very useful?
Well, definitely the psych stuff. I mean, antidepressants. I mean, patients are on antidepressants.
How many people are on antidepressants nowadays?
I mean, I don't know. Test the water. It's in there, right?
Yeah, exactly.
But, antidepressants, people get on these drugs for the right reason, but never seem to get off of them. And why is that? And it's likely because it's possibly the wrong diagnosis, or nobody has tried to take them off and see what the side effects are and how they're metabolizing the drug. So psychologic stuff is definitely a big issue. The cardiac stuff is definitely a big issue. I mean, many patients are on multiple drugs for rate control, especially like atrial fibrillation, things like that. if these drugs aren't being metabolized, I mean, you might end up with a pacemaker.
So we watch TV at night,
Yeah.
right? And we see all these great drugs, and I'm for big pharma producing some really great drugs for us that really,
Absolutely.
really do help people. But it's always interesting to me to watch how many side effects they have and what they have to post, which they legally,
are legal.
yeah, they
Yeah, those
legally
are
have to
legal.
do that. But if you're having that issue just taking one drug, then certainly there's got to be some concerns about I'm taking this one and now I'm taking something else. How are they working together? Are they working
Right.
against each other? Are we actually harming ourselves by taking those?
Yeah.
And speak to that a little bit.
Anytime there's more medications and things that need to be detoxified by the liver, that's going to be a problem. But, the reports I've seen have come across actually with mixed results sometimes too. So one drug needs to be increased and another one needs to be decreased. And so again, the difference of those two is where their problem or their symptom arises. So, sometimes it's really simple. They have pain, they're on a narcotic, they have a lot of pain and it's not working. We switch over to another one, problem solved. But sometimes when you're dealing with cardiac issues with multiple different
Right.
classes, calcium channel blockers, you're dealing with beta blockers, you're dealing with different things, where they interact causes all kinds of side effects.
So you see this as the future as far as how medications, it's almost, I use this term of, as physician having a moral and ethical obligation, as an insurance carrier having a moral and ethical obligation to make sure that patients are getting the best in outcome.
Absolutely.
Do you see that really as going forward as really, why would not you do it? I mean, why would you do it another way, correct?
Well, yeah, I mean, I can't unlearn this, right? And so since I know that it's out there, I mean, I treat my patients the way I want my family members treated. I know what I was trained with. I know how my brain thinks in terms of figuring out what choices are next in terms of medications, and I know what this says. So it's like sometimes now the only problem I see with the test is it makes me feel like I want to rely on it, and I'll jump to, well, let's get your test, and then I'll see what the results. I'll make a decision. It's like, well, for years I've been making decisions without this test, but this test is going to improve the ability for me to make those decisions quicker and more precise. So
Right. And it's all about patient outcome. It's all about taking care of the patient and really getting them to respond and have a quality of life really that they would expect. So
yeah, many times we're treating a lot of problems, and then that medication causes us to treat another problem and down the line. And even last week I had another patient that literally came in and said, I've stopped all of my medicines. He's got rheumatoid arthritis, high blood pressure, high cholesterol. 10 different major drugs that he should have been on, stopped them all and was feeling great. And his blood pressure was a little high, 160 systolic.
Wow.
So
Right.
I don't know. I've seen people go into the hospital, with 20 drugs and be discharged with 2. Everything seems to be okay. So, it's interesting sometimes how patients can go without a lot of drugs and how they respond to that. Sometimes the body is just kind of compensating for all these changes.
Asperio is a leader in research and pharmacogenetic testing. Our labs leverage over 30 years of industry experience combined with cutting-edge technology to deliver personalized and accurate testing with the industry's highest standards. We have secure, web-based test reporting software. We provide an individualized, HIPAA-compliant, web-based test reporting system that allows physicians a 24/7 access to their test results. As a team, we work to uncover and deliver targeted health insights to improve patient care. Each clinic has access to individualized customer service programs with a single point of contact for everything from sales and marketing to laboratory technical services. Our commitment to creating long-term relationships with clinics and patients help cultivate the value of our partnership.
Most insurances and Medicare cover pharmacogenetic testing for qualified patients. Ask your physician about utilizing pharmacogenetic testing to receive your personalized report. Asperio, uncovering the unknown.